In evidence-based medicine, not all studies are created equal. Meta-analysis is indisputably the highest level of scientific evidence you can possibly produce around any given topic. But why is that? Let's look first at this evidence pyramid. It ranks scientific publications from lowest to highest level of evidence. The meaning here is that out of all possible publications, meta-analysis is the most trustworthy. You know how there are randomized controlled trials in which doctors separate patients into different groups, give them different treatments, and check which works best? Well, with meta-analysis, you can use some math to put all these studies together in order to arrive at one single conclusion. To make it easier to understand, I will use the Nissen and Volksy meta-analysis on Rosiglitazone. In the early 2000s, diabetes medications were being approved mainly based on one thing: blood sugar control. If they lowered glucose, they were considered effective, and cardiovascular outcomes were always assumed safe. Then, a meta-analysis published in the New England Journal of Medicine reshaped how we evaluate diabetes drugs. Researchers pooled randomized controlled trials of Rosiglitazone and compared it to other diabetes treatments, such as metformin and insulin. Individually, the major trials appeared inconclusive. The DREAM trial with a p-value of 0.22, and the ADOPT trial with a p-value of 0.27. Nothing is statistically significant. On their own, each trial suggested no clear cardiovascular danger, so everything seemed fine. But here's where things change. When the trials were pulled together in a meta-analysis, suddenly Rosiglitazone was associated with an increase in cardiovascular death with a p-value of 0.02, and then also an increase in myocardial infarction with a p-value of 0.03. No single trial had enough power to detect the signal, but when pulled together, the risk became visible. But why did no single trial detect this before? Because rare but serious harms often require much larger sample sizes to detect, and that's the power of meta-analysis. Organizations like WHO, NICE, and major specialty societies rely heavily on meta-analysis to inform clinical recommendations, health policies, and also reimbursement decisions. Meta-analysis sits at the top of the evidence pyramid because it answers a simple but a powerful question. What does the totality of the evidence really show? When done correctly, it offers the most reliable estimate we have, and that's why it drives clinical decisions worldwide. If you want to learn how to critically appraise meta-analysis, interpret forest plots, and avoid common mistakes, subscribe to this channel and turn on notifications, because evidence matters, and understanding meta-analysis puts you at the top of the pyramid.